committee for giving me the opportunity to speak here today, and to all of you for being here. I really apologise if you can't hear me. I'm losing my voice, but I'll try my best. So as you can see, my work was done on using a second prostaglandin injection within the Ovsynch program. It was done as a master's research project through the University of Melbourne, and I would also like to thank the Vet Group, Gardner Foundation, Dairy Australia, BCF and Boehringer for their support in this project. So the background for this and why we chose to do this was that results came out from an American study showing improved conception rates when using a second prostaglandin injection within the Ovsynch program. Most of these results were based on Holstein Friesian animals in freestall herds, and we wanted to see whether or not this would work in an Australian pasture-based system with both seasonal and split calving dairy herds. So the first thing we did was to set up our study design. We chose our animals and farms that we would need to include in the study. We did body condition scoring on all animals, and we included animals that were between 2 and 3.5 in the 1 to 5 system. They could have no concurrent clinical disease, including metritis, mastitis, lameness, or LDAs. We included both primiparous and multiparous animals. Originally, we wanted to have higher than average production Holstein Friesian animals, but we also included crossbred Holstein Friesian animals, as these are quite prominent within southwestern Victoria. And we included a Jersey herd for comparison. This entire study was done in southwest region of Victoria, as you can see where the arrow is, and that's where most of the dairying is done within Australia. The herds that we wanted were herds that had good record keeping and were willing to submit their cattle for early pregnancy diagnosis so that we could be sure that they had conceived based on the program. Excuse me. So what we were comparing it to was the original Ovsynch program. We compared it to this because this is the one that is most often used within the dairy herds in that region. All of these injections were done at the time of milking because that's what the farmer does, and we wanted it to be based as close to reality as possible. So on day 0, we have an injection of GnRH. Day 7, an injection of PG in the morning at the time of milking, an injection of GnRH on day 9 in the afternoon at the time of milking, and fixed time AI on day 10. And this coincided with mating start date in the split and seasonal calving herds. All of the injections were done either by myself or another veterinarian. The same people went out each time. And we compared it to the second prostaglandin injection, which was 24 hours after the first prostaglandin injection. The reason that a second prostaglandin injection has been proposed is because prostaglandin will return to its original plasma concentration levels within 90 minutes of the first injection. And the idea behind the second injection was to have a second chance at complete luteolysis because, excuse me, it's obviously reliant on the dominant follicle and the timing. Further studies that we wanted to include were progesterone testing on a subset of animals within the trial. So we got equal numbers of cows from each herd and from each group. And the same cows were tested both at the time of the first prostaglandin injection and at the time of AI. We considered less than 1 nanogram per mil as either complete luteolysis or at the time of AI, or as N estrus at the time of the prostaglandin injection, and more than 3 nanograms per mil as being cycling at the first prostaglandin injection or incomplete luteolysis at the time of AI. So the first thing we did was we enrolled a pilot farm. This farm, as you can see, predominantly crossbred cattle. When we talk about milk production, this farm was producing 27 litres per cow per day. So part of the reason, they had 317 animals. So the idea behind this was to also help us calculate our overall sample size that we would need. And this would be in conjunction with the results that we got from the American study. As you can see from this, the modified Ovsynch group had 160 animals. The original Ovsynch group had 157 animals. The animals were split based on their ear tag numbers, so odds and evens, and the modified Ovsynch conception rate was in fact 6% higher than the control group. So those that got the second prostaglandin injection performed better in conception rates. So you can see here that they were 1.13 times more likely to conceive. At this time, we're not statistically significant. However, the project showed that we were trending towards that way and gave us the basis for how many animals we would need for our sample size. So we went on to recruit the additional herds. We got 4 more herds. We enrolled a total of 1,948 animals. However, any animal, as I said, with concurrent disease was removed from the study. Also, any animal that did not complete the treatment course. I don't know where they go, but I wrote down every single animal that got an injection. Anything that didn't complete the course was taken out of the study. So the final number of animals that we had was 1,703 animals, which neatly came out to 852 in the treatment group and 851 in the control group. This was conducted over 2 seasons. It was conducted at the end of 2015 through to the middle of 2016 so that we could allow for seasonal differences. Excuse me. The overall results showed that the animals that got the second prostaglandin injection were 1.17 times more likely to conceive compared with the animals that did not get the second prostaglandin injection, and was obviously statistically significant. We allowed for herd, body condition score, and days in milk. So days in milk, we split the animals to less than 60 days in milk and more than 60 days in milk for those confounding factors. And it still came out as a 7% difference between the 2 groups. But I did want to point out that the Jersey herd didn't improve with this. So there was no, well, I mean, they actually were slightly the other way, but 42 to 45%. There was no statistical difference between the 2 groups. It was a low number of animals that we had within the Jersey herd. They were producing 19 litres per cow per day. So I can't really comment on that, but I just wanted to point out that the Jersey herd did not improve. However, all of the other herds, the other 4 herds, improved somewhere between 5 and 11%. So then we go on to our progesterone results at the time of AI. I'll just briefly run through the progesterone results, at the time of PG. They showed that there was no difference between the number of cycling cows between the 2 groups, which is what we wanted to show. However, the progesterone results at the time of AI showed that the cows that got the 2 injections of prostaglandin 24 hours apart were more likely to have low progesterone at the time of artificial insemination. And we inferred from this that they were more likely to have achieved complete luteolysis. We then did further studies, so we split out the groups. The Holstein Friesian crossbred animals, so excluding the Jersey herd, actually improved. So there was an 8% difference between the treatment group and the control group. We also stratified by age to see whether or not there was any difference. As you can see here, the first calf heifers, the treatment group certainly did better than the control group. Whilst not statistically significant, I believe that this is probably due to our sample size of first calf heifers. The 3 to 5 year old cows also did much better having the second prostaglandin injection than the animals that only had 1 prostaglandin injection. This is in line with the American study, who found that the 3 to 5 year old cows certainly achieved greater success than any of the other groups. Cows that were greater than 5 years old had no difference whatsoever. Again, this was in line with the studies that have come out of America. I've also included here the 6-week in-calf rate. As you heard earlier, this is one of our measures for seasonal and split calving herds. One of the reasons that I did this was that some studies have shown that it may be detrimental, it may be the same, it may improve. In this instance, the 6-week in-calf rate actually stayed the same, and the overall not in-calf rate actually stayed the same as well. I didn't do that. It's broken. Did I press something? Sorry. Okay, so I'll go through to the results now. As I said, the trial was conducted predominantly on split dairy herds. They are run on pasture with grain going through the dairy. The conception rate improved by an average of 7% using the modified Ovsynch program. It was a repeatable result. So in actual fact, those farms have now gone on to use this program 100% of the time. In our split and seasonal calving herds, this means that a lot of animals, more animals conceive to AI, so all of the animals are actually submitted on the first day of mating start date. That all put through an AI program, and then some farms will continue to use an AI program, and some farms may then move on to using bulls, but this does mean that they have a greater chance of genetic diversity. They have more animals calving in the first 2 weeks of the calving period, so it allows the farmers to have their calving pens area and to organise their labour units. And with that, they were the results that we had, and I would very much like to acknowledge again Melbourne University, the Vet Group Gardner Foundation, but also like to acknowledge Mark Stevenson, who was my statistical support here, and all of my supervisors, Michael Pyman, Peter Mansell, David Beggs and Dave Colson. And this is a photo of Debbie, the other poor veterinarian who had to get up with me at 4 o'clock every morning when we had to do the injections. And with that, thank you very much. Arigato.